Healthcare workers across the province regularly face situations that put their personal health and safety at risk. That's according to a recent study, Assaulted and Unheard: Violence Against Healthcare Staff. It was co-authored by occupational and environmental health researchers who were stunned by what they heard. Those researchers are Jim Brophy and Margaret Keith, and they're with us tonight to tell us what they found. Nice to have you two here, all the way up from Windsor, Ontario. I guess you got top billing on the report. I'm not sure why. But
my last name begins with B.
Oh, so it's alphabetical order. There we go. All right, so put the first question to you. Why'd you do the study?
Well, the genesis of the study began because the healthcare unions, the Ontario Council of Hospital Unions, CUPE, was very disturbed by reports they were receiving from their frontline caregivers about the incidence of violence and how widespread it was. And so about 2 years ago, they held a conference of nurses and personal support workers, about 150 delegates, and every single delegate had been personally assaulted within the last year.
Everyone had a story.
Everyone. Some of those stories were made public, and a nurse who spoke out about it was fired. And so this started a whole investigation by the union to try to find out what was happening in the healthcare system.
All right, let's get to some of the nuts and bolts of it then. So CUPE commissioned the study. How many people did you survey?
We actually held in-depth interviews with about 54 healthcare workers from across the province. So these, what we were really trying to get at was their experiences. We know there are numbers out there. There are statistics, and those are really not debatable. What we really wanted to know is what they believed was behind the numbers. What were their experiences? What was it like to be a healthcare worker working with the threat of violence?
Now, the obvious follow-up here is that there are thousands of people who work in healthcare in the province of Ontario, and you've interviewed 54. Is that an adequate sample size to get a sense of what's going on?
It is when you're doing qualitative research. So what you do is you talk to people up to the point of saturation. When you start to hear the same kinds of stories over and over again, you know you've pretty much got the picture.
Nailed. Jim, what types of, and again, of the thousands of people who work in healthcare, they do a myriad different jobs. So who are we talking about?
Well, we were looking essentially at frontline caregivers like nurses, personal support workers, orderlies, but it also included, which was I think one of the unique features of this study, a wider array of occupations within the healthcare system. So that would be the cleaners, that would be the kitchen staff, that would be administrative staff, secretaries who might do patient input.
And you covered them all?
We covered them all.
Got it, okay. Again, we all know today that assault can be that, or it can be a punch in the jaw that breaks your jaw. That's a pretty big continuum.
It is.
What did you find on the continuum?
Well, I mean, I think both Margaret and I were horrified by the stories that we heard and how widespread and normalized violence has become within the healthcare system.
Normalized?
Normalized. And it's not just that we're saying that. That's well documented in the scientific literature, which is very robust on this issue. So we were hearing, I mean, almost all, and I mean all of the people we interviewed experience some form of abuse on a daily basis. And when we would ask them, well, you don't really mean daily, I mean, you're trying to, give us a sense of what it is, they said, no, we mean daily. And that covers a whole continuum, as you said, from physical assault, which in some cases has been horrendous, to being punched, being kicked, having your arm grabbed, your body grabbed, private parts of your body grabbed, being verbally abused, being called names. Racialized workers are targeted, women are targeted, and so on, down to harassment and assault, sexual assault.
Is this so widespread that it literally happens in every hospital in the province?
I think it does happen in every hospital. I think there are some types of hospitals, some areas in the hospitals where it's more likely to happen. And again, this has been documented by other researchers. People working in mental health, people working in emergency departments, people working in dementia care are more likely to be subject to violence. But there are people working in acute care hospitals who would go in to talk to a patient and be grabbed. There are frustrations, there are all kinds of issues that are creating an atmosphere that is, it seems to be more stressful than it's ever been. You know, they talk about how this is a growing problem, and actually that's something that we were trying to understand. Why is there more violence now than there was 20 years ago?
Well, let me follow up on that with Jim, because I wonder whether the violence is as a result of patients feeling generally mistreated in the healthcare system, or whether it is something specific to the nurse, the orderly, the whomever that they are dealing with on any particular issue. Do you have a better sense of that?
Well, I don't think that we can lay this problem at the doorstep of the healthcare staff. I don't think they're responsible. The victims, in a sense, are the responsible parties here. I think that there's been enormous restructuring of our healthcare system. The World Health Organization said 2 decades ago that you could never address the issue of violence in an under-resourced system. Everywhere we went, everywhere, the constant refrain was the tremendous burden of understaffing, the lack of resources to try to deal with prevention, simple things like buzzers, flagging, security, signs. I mean, in some hospitals, for instance, there was a sign in the food court saying zero tolerance of violence, and the nurses made point that that's not in there where they are working.
But to be clear, it's not that nurses or orderlies are doing anything wrong. They just happen to be sort of the frontline contact of the system, and therefore
that's right.
They're getting it.
That's right. They're the ones that are at the receiving end of this crisis. And it really made us realize, especially as occupational health researchers, really what is going on in this work environment for a second here. I mean, this very high demand, limited control, high pressure environment, it's a perfect cauldron, really, for a toxic work environment.
Well, Margaret, I'll get you to comment on these because I want to read a couple of testimonials here that come straight from your report. These are testimonies that you recorded during your focus groups, and here's the first one. One of the staff was working nights, and a patient bashed her head into a piece of equipment. She was by herself. She couldn't call for help. She didn't even have a phone. She suffered a concussion and never came back to work. Here's a second. We don't report sexual violence because it happens so frequently. Sexual harassment is definitely a problem for women workers. If I go in with a male worker, the patient is not going to pinch his butt. They'll pinch mine or make a sexual comment. You feel disgusted with yourself after someone makes an inappropriate pass. It makes you feel violated. How much of all of that did you run into in your studies?
We ran into that over and over again. We held focus groups where the person who was talking to us, telling us the story, would be in tears. Other people in the group would come up to try to comfort her. It was incredibly upsetting. In all the research we've done over the years, this was the most emotionally difficult data gathering we've ever done. We talked to people who have never recovered emotionally from a traumatic event. We had someone who talked to us about a sexual assault that was just dismissed by her manager as unimportant because she wasn't actually raped. She was fighting for her life, physically fighting for her life, the patient who had attacked her.
A male patient,
a male patient, a strong male patient. And she ended up having to take some time off work, but the issue was never treated seriously. And this is something that we heard over and over again, that violence and sexual violence, sexual harassment are just something you have to put up with. It's part of the job. Some of them were actually told that. You know, when you went into this profession, you knew that you were going to have to put up with this sort of thing. It's unfortunate, but that's the way it is. They don't get the kind of support that they need to be able to become healthy again after an episode like this. Women who have been, and you know, we're hearing so much about it now with what's been going on in Hollywood.
I mean, this is a story we expect to hear out of, you know, the stereotypical Hollywood producer, et cetera, but we don't think of patients vulnerable in hospitals as being the typical perpetrators of this kind of behavior.
I was surprised by how much of this I was hearing and how easily it was dismissed and how hurt so many of these women still are by it. You know, people who have suffered that kind of trauma need help in getting over it. Otherwise, they're going to continue to carry it with them. It affects other parts of their lives. They're triggered, which is what was happening in that group that I was telling you about. The woman who was telling us about the sexual assault was triggering the other women in the room. And you could see that, you know, the way they were acting, they had their stories to tell as well. Some of them had difficulty looking at us in the eye. You know, they were shaking and upset. Other people crying. I think this is a very common experience, and I don't think it's being treated seriously enough. You can't just dismiss this sort of issue as unimportant. And going back to Hollywood, I mean, this is what was happening 20 years ago. You were expected to put up with this. It was part of the job. If you wanted to get ahead and become a star, you had to put up with a certain amount of sexual harassment and even assault. You were quiet about it. And somehow the healthcare workers are expected to still, in this day and age, to be quiet about it. They're not allowed to go out and talk about these things.
No, but I mean, if the Golden Globe Awards are any indication, we saw those buttons, time's up. Time's up in Hollywood. Is time up here now?
I think so. I mean, I think it is becoming increasingly clear that the healthcare workers are not prepared to accept these conditions any longer.
And they're prepared to go public, to report on these things, to bring it to management's attention?
They're bringing, I mean, part of the frustration is that they are bringing it to management's attention, although they feel that it's not very productive. They don't think anything will really happen about it.
Why is that?
Well, because of their experience. I mean, we sat in a group, for instance, the normal process here would be the Joint Health and Safety Committee would have a report on these things. And so we saw evidence of 2 years of health and safety meetings each month, where every month, 8, 9, 10 cases were reported. Same thing the following month. No follow-up. No.
And management's response would be what?
As I think Margaret said, this is seen as normalized. This is part of the job. You know, as soon as and the fear of reprisal is enormous. People feel if they speak out about this, that they will be targeted, they'll be stigmatized. They're forced, if they go so far as to speak publicly, well, then, you know, they could lose their employment. I mean, that was very much a part of every beginning of every session we had. People's fears that if any of that ever became public about what they were doing and what they had said, that their jobs were on the line.
But let's keep at the risk of torturing the metaphor here, let's do the Harvey Weinstein comparison here. You know, Harvey was a big, powerful producer in Hollywood who could make or break your career if you didn't play along with his obscenity. These tend to be vulnerable patients who are doing this kind of inappropriate behavior. Does that make it different?
I think we have to take it beyond the patients. I mean, we have a system that is allowing this to happen, that is keeping women quiet about these issues. And, you know, I can't understand why it is that the patients are doing this. Some of them have dementia, perhaps. You know, that was certainly the case with the people working in long-term care. Others just feel that they somehow have the right to be abusive to nurses. There's you know, there's this image of the sexy nurse. There are sexy nurse costumes that you can get for Halloween. I think there's still this image somehow that a nurse is somehow open to this kind of harassment.
And I should clarify in this story. It is patients that you are finding are doing the abuse here.
Yeah,
We're not talking doctors or managers.
No. In fact, our study was type 2 violence. So this was patients or their family members against the staff. No, these are patients. These are patients who will be lying in a bed. A nurse will walk in and they'll just reach up and grab her breast. Or, you know, we talk to people who had been groped on a regular basis. You know, they'll pull away, try to say something to the patient, maybe step out of the room for a minute and come back in. I think they should be able to go to their managers and have their managers come into the room and say, this is not acceptable. You know, we should have zero tolerance, and that zero tolerance policy needs to be enforced.
Well, I was in Sudbury over the holidays. I have a relative who's in hospital up there, Health Sciences North. There are signs on the walls everywhere saying, we will not tolerate the abuse of our staff by any patients and visitors. They see all that there. Are those signs not working?
Well, first of all, I mean, I'm very pleased to hear that Sudbury is doing that, but you could go to any number of hospitals throughout the province and you will not find that. I mean, the differences the lack of supports from one place to the next, the lack of consistency of these policies is universal. I mean, in some cases, we mentioned it in the report, one of the nurses said the first time she found out about that there was such a thing as a buzzer was, at a conference when a healthcare worker, someone out of laundry, told her that every time she went on a certain floor, she had to put it on. She said, I didn't even know there was such a thing as a buzzer. We just scream. So that kind of lack of consistency, lack of across-the-board policies, the fact that you could work in one location and have that support and not in another we found that everywhere.
Okay, we should say right here that we did our due diligence journalistically here and did invite somebody from the Ontario Hospital Association, which obviously represents all the hospitals in the province of Ontario. They didn't get back to us. We were prepared to invite someone to come on the program and discuss this. They didn't get back to us. We reached out to the Office of the Minister of Health and Long-Term Care, Eric Hoskins. He was apparently unavailable. But here's what his office did send us in a statement. And we'll put this up here right now. Since 2007, the ministry has invested more than $20 million in supporting healthier work environments and patient care. They have launched a workplace violence prevention in healthcare leadership table, which has made a number of recommendations to improve the safety of healthcare workers. Since 2014, through the Ministry of Labor, they are inspecting all acute care hospitals. They are also inspecting some long-term care homes and community-based health care services. That's the official reaction from the Government of Ontario. Thoughts?
Okay, we've read the report, and we have actually spoken to people from the government about this, and they recognize that the problem exists, and they have gone through and come up with recommendations. And I guess our reaction is that we've known about this problem now for at least 20 years. There have been hundreds of articles published about this problem. Thank goodness they're finally looking at the issue, but I think it's awfully late. And a lot of these things are still just recommendations. They haven't changed the laws.
Do you think they're adequately in government seized of the significance of this and prepared to make some changes?
I think they do understand. I think their hands are tied by lack of resources. As Jim was saying, you really can't fix this problem without having funding. One of the biggest problems is understaffing. You don't have enough staff to go in and do
Okay,
team.
sorry, dumb question here. Why do you need more money to enforce a code of conduct among patients?
I think that one of the problems is that you have a lot of patient frustration. They're waiting. You can go into the ER and wait for hours to see someone. The patients and family members start to become agitated. When you're in the hospital, you're already a bit emotionally compromised.
Sure.
And if you feel like you're not getting the care that you deserve, you're going to lash out.
So a better resourced healthcare system would reduce these kinds of incidents in
It
your
would
view?
address the systemic issues.
It would also permit the people with mental health issues to go into appropriate facilities. We've cut way back on mental health beds and on community programs that would have maybe prevented people from having to show up in the ER in a crisis. And these are, this is such a complicated problem, and there's no one easy fix. But what we saw over and over again, in talking to every one of the healthcare workers that we've spoken to, there were, so these top three things, and top, I think, was staffing, the understaffing problem. The other was this lack of respect, this dismissal of the problem. You're expected to put up with it, as Jim was saying, the normalization of violence. And then also this culture that exists within a lot of the healthcare facilities. In a lot of ways, this is a systemic cultural problem.
Jim, you wanted to add?
Well, I think about, the government's position here. I can tell you on the ground that the regulatory system is absent. There was no confidence that the Ministry of Labor or the Ministry of Health or any regulatory group, the workers' compensation system, was anywhere in this picture, other than as a possible antagonist. That if you never expected the Ministry of Labor, for instance, to intervene and address these issues. It was the healthcare workers' experience was that the regulatory system was absent, and they experience the tremendous, lack of resources, the continuing lack of resources. I mean, it's very common for people all by themselves to be working alone at night on large wards, facing, or, a nurse on one floor and a PSW on another, all by themselves, and without any security, without any, buzzers, without any kind of backup. So this kind of atmosphere, I mean, I think it's a real barometer of the health of these healthcare workers, as a barometer for the health of the healthcare system. I think we have a very serious crisis, if you will, in our healthcare system that is allowing this type of behavior to develop.
Okay, a couple of minutes left, and I want to touch on a couple of more things here. Margaret, this is not a cynical program, and I'm not a cynical person. However, you're going to forgive this question. CUPE, for whom you did the study, and the Ontario Hospital Association are constantly in negotiations for, as contracts end, and then they have to renegotiate new contracts. I'm sure they're in contract talks all over the province right now. A cynical person might wonder whether or not this study was done at this particular time in order to have a particular influence on whatever contract negotiations are happening right now. Speak to that, if you would.
Okay. I mean, I'm not a member of CUPE, so I don't know. I can't say what their timing is. I believe they are in contract negotiations now. We started this study a year and a half ago, and we went in independently. We had to follow our own code of ethics through the University of Stirling. We went in and asked the questions and produced the results. And
at no time did CUPE say, boy, it'd sure help us out at contract time if you could find something really outrageous.
Absolutely not. In fact, we were so surprised by what we were hearing. We didn't have a sense from them that they expected to hear anything like what we heard in these focus groups.
Jim, you want to speak to that?
Well, I think, first of all, we're not a part of the union, although we've worked with them very collaboratively on this study. But negotiations actually have broken down, and it was on the question of violence. The union has made this a very important issue. Like the human rights of their members is becoming increasingly important. And I thought it was very informative that they could not reach any kind of common ground. Like, I think the distance between the experience of the healthcare workers, the frontline healthcare workers, and the people that are running the hospitals and the healthcare system.
You think the hospital management just doesn't care enough about
It's not just that they don't care, but I think it's not on their radar. I think that the budgets and programs and probably the higher level professionals within the healthcare system dominate the agenda. And what's happening to nurses and to personal support workers and to the cleaners, that's just not on. And that's the story that we heard, and it's actually, I mean, it's very much validated within the scientific literature.
In which case, Margaret, let's finish up on this. How confident are you, having done the study, having seen management's reaction so far, having heard the response from the Ministry of Health and Long-Term Care, having seen the Hospital Association's replies, how confident are you that anything's going to be done about this?
I'm hopeful that it will be, and I think one of the big things is that the general public needs to know that this is happening. I think they have a suspicion of it, but I think it's important that healthcare workers be able to speak out about it, and I'm glad that we had the opportunity to be able to do this study and be able to get this information out, because I don't think the general public wants this to happen. And I think once they hear about this, they'll be putting pressure on our governments to do something about it.
The name of the study is Assaulted and Unheard: Violence Against Healthcare Staff. A real eye-opener. Jim Brophy, Margaret Keith, we're grateful you came all the way from Windsor to TVO tonight to share your views on this.
Thank you very much.
The Agenda with Steve Bacon is brought to you by the Chartered Professional Accountants of Ontario, helping businesses stay on the right side of change with strategic thinking, insightful decisions, and business leadership. Are you on the right side of change? Ask an Ontario CPA.